And welcome to another show here at the beautiful studios of WGNU 920 AM, St. Louis Urban Forum, a station that talks with you and not at you. Welcome to Closing the Gap on Prostate Cancer in Our Community. I am your host today, Brother Melvin Shaheed, prostate cancer survivor, prostate cancer advocate, and a very proud servant to cancer victims throughout the city of St. Louis, the founder and the CEO of the Empowerment Network. I'd like to thank our listening audience for tuning in today as we make another attempt to close the gap on prostate cancer, other types of cancer, health issues, and health disparities that face our community. On our show, we ask the tough questions and we make the bold statements to help the community get a better understanding about this topic called cancer. At the Empowerment Network, we don't run away from the problems caused by cancer in our community. We run to the problem to help solve the problem with cancer. As cancer survivors, we're not afraid to talk about it. In fact, we talk it up every Friday at 5 o'clock p.m. So St. Louis, let's get this party started. But before we get started, we have a few quick community announcements to make. And I think we got a caller on line one. You got Kathy on line one. We got Kathy on line one.
Hi, Melvie.
What's going on, baby doll? Talk to me.
How you doing?
I'm doing excellent. Top of the day to you.
Excuse me?
I said top of the day to you.
Same to you. Same to you.
What you got for us?
Well, what I'm calling about is our 40-year class reunion for Sumner Alumni Class of 1972 is going to be held at the Airport Hilton September 14th and 15th. That's a Friday and a Saturday. And if anyone has any needs to know anything as far as someone to contact, they can contact me at 314-445-4715 or can email me at kathylscott@yahoo.com. That's Kathi Scott@yahoo.com.
Home of the Bulldog, sister.
That's right. That's right.
40 years passed real fast, and I am looking forward to this event. I can hardly wait. So this is a shout-out and a call-out to all the Sumnerites, class of 1972. We want you to be there. Kathy, give it out one more time real quickly.
Okay, that's at the Airport Hilton, September 14th and 15th. That's Friday and Saturday. It starts at 6 p.m. on both days. You can contact me at 314-445-4715 or email me at kathylscott@yahoo.com. That's Kathi.
Thank you so very much, Kathy. And please continue to listen to our show.
I certainly shall.
And we have another quick announcement. St. Louis, there is an exciting health fair that is coming up September the 7th that you don't want to miss, and it is all free. Tell us about that health fair real quick.
Yeah, hi. I'm Dr. James Kelly, and I'm here at the show, and I'll be involved in this health fair as well. We're having this actually at my office building at 3535 South Jefferson, which is close to St. Alexius Hospital. And this is a community health fair. It's free admissions and screenings. It's Friday, September 7th. Which is just a couple of weeks away, I think 2 weeks away, from 10 a.m. to 1 p.m. It's in the St. Alexius Hospital Medical Office building, which is up the street a little bit from the hospital. It's where the old Lutheran Hospital used to be, but we have a big medical office building, and it's clearly marked St. Alexius Hospital Medical Office Building at 3535 South Jefferson from 10 a.m. to 1 p.m. on Friday, September 7th, and we'll be doing... I'm a urologist, and I'll be there talking about prostate issues to anyone who wants to hear that. We are going to have PSA blood screening for prostate cancer, but also there'll be a variety of doctors in all specialties checking blood pressures, blood sugar, cholesterol, body mass index. And this is all free, and it's coming up 2 weeks from today.
So what's the title of that health? I like this title. It's catchy.
Just for the health of it.
Just for the health of it. Now, that's simple and plain. Just for the health of it, St. Louis. This is going to be an exciting event. I will be there. Dr. Kelly will be there. And the St. Alexius team will be there, at this health fair. So we want you to come on out and be a part of this great event. Now on the show today, St. Louis, I'm honored to have back as our guest in the studio today one of the doctors who was a part of that discussion a couple of months ago surrounding the United States Preventative Task Force ruling that stated that the PSA test was doing more harm than good for men in our community. That's right, St. Louis. Dr. James Kelly is back again to share his insights to help you, the community, better understand the basics surrounding this disease called prostate cancer, what treatment options are available, what conversations should men in St. Louis have with their urologist, and how those conversations with your doctor affects you and your loved ones. Yes, another exciting show that will make you want to sit back, kick back, relax, kick your shoes off, and get ready to be educated about you and your prostate health. Sponsored by a great friend at St. Alexis Hospital, and their motto is, our patients' wellness is our success. Let's meet this great doc right after this very important announcement. Closing the gap on prostate cancer in our community with your host today, Brother Melvin Shaheed. You can call into our show today at area code 314-448-4325, or you can call in toll free at 877-920-9468. We're streaming live on the web at WGNU920am.com. Please follow the Empowerment Network on Facebook and on Twitter. St. Louis, we're honored to have back in the studios my very good friend, Dr. James Kelly. Welcome back to the show, my brother.
Thank you, Melvin.
Better known as Dr. K, who still answers his own phone calls. You didn't think I remember that from the last show, did you?
Well, I didn't recall that, but I do answer my own phone, and I've been doing it that way for some time. I run a manageable small practice, and I try to keep in close touch with my patients, and I find if I keep the lines of communication open that I really don't get pestered a whole lot from people.
Well, that's a great way, Doc, to keep your lines of communication open, because oftentimes, being a cancer survivor myself, and I understand that a patient sometimes want to be able to talk to the doctor. They want to be able to get a return phone call from the doctor, because I know y'all have busy schedules, and I know the offices can get pretty packed at times, but sometimes when a doctor can just return a phone call and leave a simple message, that goes a long, long way. Wouldn't you agree?
Oh, I agree, and I've always been in a solo practice. I've worked with other urologists in the community, but there's been a number of us that have worked small solo practices and covering for each other only on extreme circumstances, but pretty much around the clock. And you find, as I say, if you keep your lines of communication open, and that you find that you don't have people calling and bothering you a whole lot. A lot of people have a lot of respect for your time, and then they tend to listen, and so I take a little extra time to hopefully keep people educated and satisfied with the service.
Well, that's a great concept, Doc. And also the studio has a lot more room than it had last time you was on the show, man. Last time you was on the show, you was kind of sandwiched in. You didn't have a lot of elbow room, man. We had you right in the middle. I think we had 5 doctors on the show, and we were talking about that United States Task Force ruling, and they had you sandwiched right in. Do you remember that?
Oh, I remember.
But Doctor, we're delighted to have you back on the show, and we're excited to partner with the only community-based hospital that is still left in the St. Louis area, the St. Alexis Hospital, on this great health fair that is coming up in September. Now, at the health fair, you just mentioned it, that this great hospital will be bringing to the community, free PSA testing for men in our community. Dr. Kelly, the magic word is free. Free, it doesn't cost a thing. Men can step up and take that simple blood test that might save their lives. So what would you say to the men in the community about that simple blood test? Should they be there? We should have a line all the way around the hospital, shouldn't we?
Well, over the years, I've done quite a number of these PSA screening programs, and over the years, a lot of people have sponsored these, and in fact, quite literally, at a number of screening events, there is a line, around the block for these things, and should be, and hopefully still is. I do know that as time has gone by, more and more men have gotten this as a routine component of their physical exams with their primary doctors, but we still have a good turnout for these screenings, and I think we should still have a good turnout for these screenings. Quite honestly, in all frankness, as far as medical economics go, the PSA test is not a highly expensive test in the grand scheme of things compared to screening for things like cholesterol and mammograms in the women. The PSA, and so we've always had good sponsorship when certain sponsors have picked this up. It's a great offer for the community, and it gives a chance for men to come out and get this done. And it's something that a community hospital like St. Alexius can do without a great offer to the community at a great benefit at a reasonable expense.
But the magic word is free. Like my grandfather used to always say, you can't beat that with a stick. You can't beat it with a stick, And I'm looking forward to Doc, to this great event, because I'm a firm believer that health is wealth, that health is proactive and cancer is reactive, that health is encouraging and cancer is discouraging. How did you like that, Doc? See, you didn't know I could flow like that, did you? Huh?
You're a real poet there, Melvin.
but really, that's the reason why this health fair is so important, because it encourages the community to stay on top of their health. This health fair is a proactive way that the community can stay on top of their health. And wouldn't you agree with that?
Absolutely.
Now, I know that, I'm known for making the bold statements. I said that at the beginning of every show. And I can ask the tough questions around some of the many topics that I have on my show. So quickly, let me make a very bold statement on the ruling from the U.S. Preventative Task Force that we talked about on the last show. And I asked, this question: how can we have a ruling of this magnitude surrounding a major health disparity like prostate cancer without the men in our community having the proper information and the proper education so that they can make an informed decision around this topic? They made a ruling on a major health disparity that many men in our community still know little about. Now, wouldn't you agree that that's a fair statement? I mean, you're making a ruling, and there are still a large percentage of men in our community that don't understand the basics around prostate health, prostate awareness. Many men probably coming to your office, Doc, for the first time, and they don't know what a prostate is. They don't know what the function of a prostate is. And we got street doctors, and we talked about these street doctors on the show. These street doctors like Ed the Barber, Wooly the Shade Tree Mechanic, and Pee Wee the Hustler, giving out all these urban myths in the community around prostate awareness and prostate health, and when you don't correct the myths become the message. And many men in our community now are going to the car washes, getting educated about prostate awareness, and they should be coming to great doctors like you so that they can get the right understanding about prostate awareness, prostate health, and prostate cancer. Wouldn't you agree with that?
Oh, absolutely. There's a lot of misunderstanding surrounding the prostate gland and what it does. I had said before the show, I made this comment many times. I said, I know doctors who don't know what the prostate cancer does. It's a small organ. It's in the realm of the urologist, and it's kind of our responsibility. And it's considered this small little organ that is meant for the urologist to deal with. But unfortunately, it's one of the leading causes of cancer in men. So it's this little acorn-sized organ that sits down in the bottom of a man's body and causes one of the leading causes of cancer in men.
Right. So let's deal with the basics. Let's go back all the way to square one, and let's find out what is a prostate. For the St. Louis area men and women that are listening today, let's go all the way back to the very beginning. Let's go back to elementary school and say, what is a prostate?
Okay, Melvin. Well, the prostate is one of men's sexual organs, and it is located in the very lower part of the pelvis. It's hard to get at it because it's only about the size of an acorn, and it sits down.
That's not very big.
No, sir. It's not that big when we're young men, when we're in our 20s. Now, by the time we get to be in our 50s and 60s, it's grown to the size of a peach or a lemon or so, and sometimes as big as a grapefruit. I'm not exaggerating.
You have seen them get that big in men.
Oh, absolutely, and they grow in all men, but they start as a small gland. They're located in the very lower portion of the pelvis. They're real hard to get at. You can't poke at it. You can't feel it unless you stick a finger in a guy's rear end, and then you can feel the darn thing. It's just right inside there.
So when you say sticking the finger in, you're talking about the digital rectal exam.
That is precisely right.
You're talking about another procedure that many men in our community are terrified of. You know, and what's the importance of the digital rectal exam? I mean, why?
Well, so that we can feel the surface of the prostate.
Okay.
And we can feel that it feels smooth and doesn't have any, the term we'll use is nodules. I like to say lumps or bumps, because those can be indicative of cancer. And it's very important to feel it, because the PSA test can from time to time be slightly inaccurate. It's very important to put a finger on that gland and feel for what we'll say nodules, and we use the term digital rectal exam. The term digit refers to the finger.
Okay. Well, so in other words, what you can't see, what you can't smell, what you can't taste, what you can't hear, you know, God has gifted doctors like you to be able to feel. Am I correct with that statement? You can actually feel it. You can feel this organ. And if this organ has lumps, if this organ has bumps, then it will let you know that something might be going wrong or with this particular organ in the body. Am I correct?
That's absolutely correct.
Okay. So, Doc, the PSA test. Okay, you know, we talked about that on the last show, and I think the controversy is surrounding this particular test from the U.S. Preventative Task Force, the PSA test, and you just said it, you know, it offers no guarantees. You know, it's not 100% accurate, but it's the best that we have, you know, and also the PSA test is a great indicator about the numbers in the body, you know, the prostate numbers. When was this test discovered? How did it all start? How did it all come about? Remember now, we're sticking with the basics. We're going back to the basics. Do you remember how it all got started?
Well, sure, yeah. As a matter of fact, even though I've been at this for about 15 years, that was about the time that PSA was initially discovered. It was discovered in the late 1980s. It's actually a protein that is made by the prostate gland. The PSA refers to prostate-specific antigen, and that term antigen refers to a protein that's detectable in the bloodstream. And it was discovered that this protein was made by the prostate. It actually has an enzyme function in the prostate, but when a prostate is functioning normally, your PSA levels in your bloodstream are very low. If there's anything wrong with the prostate, like cancer, or other things like infection or benign enlargement, your PSA level goes up. And it's an indicator of some problems or enlargement or infection, or most concerning is a cancer. And it's fairly reliable for those things, those three entities. Now, when you detect a man with elevated PSA level, sometimes it's not cancer. Sometimes it's just an enlarged prostate, or sometimes it's a low-grade infection in the prostate. So those are the importance of doing both the digital rectal exam and sitting down and asking a guy what his urinary symptoms are like. Does he have frequency, urgency, burning? Does he have a weak stream? Is he up 3 or 4 times at night? A simple little battery of questions, and it can help us figure out exactly why, you know, he's got an elevated PSA.
Okay. We got to pay a few bills. We're going to take a little break, but you mentioned the word cancer. I want you to break down what is cancer, and we're going to talk about that right on prostate cancer in our community with your host today, Brother Melvin Shaheed. You can call into our show today at area code 314 448-4325, or you can call in toll-free at 877-920-9468. We're streaming live on the World Wide Web at WGNU920am.com. Dr. Kelly, before the break, you mentioned that word called cancer, and on this show, we often say that cancer is the most feared word in 7 different languages throughout the world. Throughout the world, when those people in the communities, or even in other countries, hear the word cancer, it reaps terror and fear into their lives. Tell us, what is cancer?
Well, cancer is a situation where your normal cells are growing unchecked, and they grow into a mass and then eventually spread into other organs of the body. Cancer can arise from almost any organ in the body. There's hundreds of types of cancer. Over the years, because of the way that cancer behave, you think that it makes sense that they would all have some common basic defect that causes these cells to behave this way, whether the cancer originated from prostate or breast or lung or liver or pancreas. And there's probably some truth to that, but getting down to that very basic cause of this unchecked cell growth has been very frustrating, and most cancers are still treated rather specific to their cancer site. And it has been a struggle to identify one basic underlying cause for all cancers, even though theoretically it seems as though there should be.
So prostate cancer would be cancer of the prostate. Am I correct in saying that? Because I don't want to give out misinformation, but it would be the prostate itself has become cancerous.
That's exactly right. The cells that line the inner ducts of the prostate gland begin to grow unchecked, just like they do in other organs, but but these originate from the prostate itself. And they grow into a nodule. They grow for quite some time, but then and remain locally within the prostate. And this is true of all cancers too. But eventually they'll start to spread through the bloodstream or through the lymph nodes into other organs, adjacent and distant organs, such as the lymph nodes nearby, or spread into distant areas such as the bones and the bone marrow.
Let's go back a little bit. Let's circle the wagon. One of the urban myths that was asked to me, a man asked me, he said that he heard that a man could not live without a prostate. Now, I'm a prostate cancer survivor. And I told him, he said, and he disputed me. He said that a man could not live without a prostate. So from a medical perspective, break it down can a man live without a prostate? This is a myth in our community. There are a lot of men in our community that believe that you cannot live once that organ has been, or that gland or organ has been removed.
Yeah, well, I've heard a lot of myths about the prostate, because there's a lot of people who are unclear on exactly what the prostate does. But certainly that is entirely a myth that one cannot live without a prostate.
But I'm a living example of it.
Oh, absolutely. And, the prostate has a very specific function, and it is involved in men's sexual functioning and intimacy, but it really actually has a very small role in that. And it's really just most specifically responsible for making the seminal fluid that men produce during intimacy. And by treating the prostate, that's the only portion of that is sometimes affected, and not always at that.
Okay.
You can take a prostate out, and men are still able to function in intimacy. They're still able to function just as they did before.
Okay. Because you're alluding to another myth. That's another myth out there, and that's probably the number one myth in the community. Surrounding the or prostate cancer and prostate issues. But we got a call on line 1, and his name is just like mine. He's a Melvin. We got Melvin on line 1. Come on, brother Melvin, come in.
Hey, Melvin, how are you?
Hey, your name is just like, almost like mine, so. Top of the day to you, Brother Melvin.
How are you?
I'm doing excellent.
I just got in my car, just turned it on. And I don't know, did you cover the problem people are having, or the society is having so far, or the medical people are supposedly having, with the fact that they don't think the PSA test is necessary, or we're doing too many?
That's a great question.
Has that been covered?
Well, we talked about it a little bit, but did you, Brother Melvin, did you want to talk about the specifics of that? Do you want to go into depth just a little bit more with that question?
Okay, well, the thing is, the medical field, or some people in the medical field, have come back with the information that they don't think that the PSAs are necessary. They're doing them, and it's not necessary for them to be done. But the high-risk individuals, African Americans, those with prostate cancer already in their families, they are the ones that need to be tested. Bottom line, so it just does not seem to be true, or the possibility exists that when the studies were done, they did not look at the high-risk individuals.
Okay. But you sound like you're right on point, Brother Melvin. You are right on point. That is an excellent question. And we're going to give the doctor a chance to answer that question. Now, do you have any other questions or comments?
That's it, sir. I'm listening. All
right, then. Thank you, and please continue to listen. Dr. Kelly, I know we talked about it a little bit. We talked about that U.S. task force ruling. We talked about it with the 5 doctors, and you were one of those doctors. But for the St. Louis community that wasn't blessed and fortunate to hear you great doctors that day, to hear St. Louis's very own task force, because that's what we did. We formed our own task force right here in the studios to challenge that ruling. So can you kind of answer that question for Brother Melvin that he just asked surrounding? And I think what he's saying is the question, is it doing more harm than good? The PSA test.
Well, I think the long and the short, those are all interesting questions, because the response to that is still an evolution. And since we did that show a month ago, we've even had more meetings on this topic, and there's been more organizations make statements with regards to that. And we were reviewing one just the other night at one of our urology journal clubs from the Society of Clinical Oncology, who made a very strong statement against that, and that was a recent development. And we've also reviewed more statements against that U.S. Preventive Task Force Services. There's little doubt, like our caller had asked a question that was actually to the point, is it just plain wrong? And, as a couple of months has evolved since that statement, many of us are drawn to the conclusion that was just plain wrong. Right. And then the subpopulation of African American it is entirely wrong. Right. And the caller asked that too. He said, did they look at the subpopulation of African Americans? The answer is, by all means, yes, they did. And we all recognize that the increased risk population needs to continue to be extremely diligent about PSA testing. And it's just unfortunate that they make a statement like they did. And quite honestly, it's evolving to the point where it appears that it was just a mistake that they made. There are a lot of the statement that they made pertains to the low risk white American male. Okay. And not much else.
Okay. And let's kind of go back a little bit. Since today's show, we're dealing with the basics today. We're going back to the basics. And I think, during the break, we had mentioned, what was going down before the PSA test. Men have been getting prostate cancer for hundreds of years. And they were walking into urologist's office like yourself with late-stage cancers that had possibly spread it throughout their bodies. What method was used? Because you remember now, before the PSA test, how did they check these men for prostate cancer or for prostate issues? How were they checked? Was the digital rectal exam the only way to check a man at that time?
That was the only way.
Wow.
And oftentimes they didn't even get that. And a lot of men, a lot of doctors felt that there wasn't a good, effective way to screen for prostate cancer. And the typical urologist, such as myself, would have a fella walk in who's having urinary troubles. He's all blocked up, completely blocked up. He can't pass his water. And I put a finger in the rump, do a digital rectal exam, and I feel this stony, hard, rock-hard prostate that obviously has been growing a cancer for probably 5-6 years. And it's been silent and it's been slow until it's obstructed his urinary flow. Or the other example was a poor fella who got up out of a chair. Maybe he slipped on the ice a little bit and he fell and he broke his hip. And he goes to the emergency room and they do some x-rays and they find out there's cancer all in that hip, and that hip was weak to begin with, and that's what happened. And then someone comes along and checks his prostate by doing a digital rectal exam and feels a stony hard prostate that's had cancer growing in it for 6, 7, 8 years. That was the way these things were discovered before PSAs, and these guys had completely progressed cancer that had already obviously spread into the bones and caused all kinds of problems, and they didn't have much hope, and they didn't live much longer after that because their cancer was so far spread.
So it's safe to say that the PSA test has saved lives.
The statistics show it as well. 10 years ago, there was still some question in that. Even 5 years ago, there was still some question. But in the last 5 years, we've really started to show that it clearly saved some lives.
Well, I know it saved my life. And we got Brother Thea in the studio. He's a cameraman. But Thea, it saved your life?
Big time.
You know, so, I mean, we have a support group of men, and many of them are here today because of the PSA test. It was a great indicator. A lot of them, they use that PSA test to monitor those numbers. And as those numbers over the years start elevating, you know, it was a way for me and for the doctors to say, well, we need to take it a step further and do, you know, more testing and everything. You know, and we said that it was not perfect. There are no guarantees, but it is a great indicator, wouldn't you say?
Absolutely.
So, hey, Doc, I'm at risk for prostate cancer. I mean, every man is at risk for prostate cancer if he has a prostate, correct?
That's exactly correct.
So what age should these men who are at risk, and all men are at risk if they have a prostate, what age should they be getting checked? You know, and that's going back to this great health fair now, because we got a free health fair here that we'll be testing men at, and they got to take advantage of this, man. We got a great hospital, St. Alexis Hospital, man, that is really opening up the doors to the community's health by sponsoring this great health fair and everything, you know. So tell us about the risk factors surrounding this, man.
Well, for men with prostate cancer, the answer, otherwise healthy men with no family history, that's the big thing, family history. The age of 50 should suffice. Now, some have said that the African-American men should start at the age of 45, and I tend to agree with that. And for any man who has a family history, you want to start at age 45. It probably doesn't do a great deal of good for the 35-year-old man to come by the prostate cancer screening booth. We've shown pretty clearly that men who are in their 30s just don't develop prostate cancer. Now, it does start in the 40s. And men, especially African-American men, especially men with a family history of prostate cancer, should start their screening at age 40 or 45. A low-risk man with no history. So, for instance, I don't have any family history of prostate cancer. My father is 75 years old. He's never had any troubles from his prostate. He's got 5 brothers. None of them have ever had problems from their prostate. So, you know, I wouldn't start prostate cancer screening until I'm 50. But for anyone that has any family history, they should start at age 40 to 45.
Okay. Now, you know, our co-host on the show, Brother Lee Muhammad, I was hoping that he might call in, was diagnosed with a stage 3 prostate cancer at the age of 36.
Boy, you're going to make me eat my words, Melvin.
Yeah, so, I mean, you know, it shows, it's showing that in African-American men, this disease is highly, highly aggressive. And, you know, he coined the phrase that early detection is the best protection. You know, the sooner we can get tested from this disease, you know, the likelihood that our survival rate will increase. I mean, do you agree with that?
Oh, absolutely.
Okay. So now, does the risk increase with age?
Oh, absolutely, yes. And by the time, as a matter of fact, by the time men are in their 80s, it's said that nearly 50% of men will develop prostate cancer.
Wow. So 50% of men who are living at the age of 80, it's a great possibility that they probably have prostate cancer. And it's probably just a slow growing. Tell us about it.
That's exactly right. And, that number, most all of those men, and that's one of the reasons why we stop recommending PSA cancer or PSA screening by the time men to get to be 70 or 75 years old, because what you would detect is these are slow growing prostate cancers that never cause men any problems. And if a guy is lucky enough to live to 85 and not get prostate cancer, as crazy as it sounds, there's a very good chance he still could develop some prostate cancer, but there's very little chance that cancer would ever grow enough in his lifetime to cause him any kind of effect.
Okay. St. Louis, our guest today is Dr. James Kelly. I call him Dr. K, who is a urologist, and he is one of the many great doctors at a great hospital called the St. Alexis Hospital. And we're here today. We're talking about you and your prostate health. Doc, if you got a guy out there right now and he's having some issues and he wants to see a great urologist, give us some information about you. Give us your address, your phone number. How can you be reached?
Sure. I'm relatively new to St. Louis. I've only been here for 2 years. I came into St. Alexius Hospital because of a need for urologic services down there in South City. I'm in solo practice, and I am located in the St. Alexius Medical Office Building. We're at my phone number. My office phone number is area code 314-771-5822. We are in the St. Alexius Medical Office Building at 3535 South Jefferson. I'm in Suite 114. I also have an office out on Hampton. The St. Alexius facility has an office on Hampton Avenue. We're at 5213 Hampton Avenue. Our phone number out there is area code 314-646-0478. And I work Monday through Friday, 8 to 5, and around the clock if I have to.
And there's a good chance you might answer the phone if they call, correct? Huh? Good chance you might pick up that telephone.
Well, I do have office help answering that number. I think Melvie might have called on a day when one of my girls was out or something.
Right after this break, since we're keeping with the basics today, and we often say on the show, we keep everything 100. We keep it real on the show, but we want to talk about some of those symptoms. Men out here got to know that there are symptoms, and if they're experiencing those symptoms, they need to know what those symptoms are. We're going to talk about that right after this break. To Closing the Gap on Prostate Cancer in Our Community with your host today, Brother Melvie Shaheed. You can call into our show today at area code 314-448-4325, or you can call in toll-free at 877-920-9468. We're having a lively discussion, a great discussion about you and your prostate health, and we took it all the way back to the very basics because, I was always taught that if you stick with the basics, you'll never go wrong. Today, we're sticking strictly with the basics so that men can understand it. Well, I'll call it the ABCs of prostate health. Tell us about those symptoms, man. And I think you talked about a few of them earlier in the show, but tell us about those symptoms. You got a lot of men out here today that are having symptoms, but they don't know that these are symptoms. Talk about it.
Sure. When it comes to symptoms in prostate, I oftentimes do like to start with, and it's kind of scary. It's one of the reasons why, cancer is one of the 7 feared words in 7 languages, is that, in the earliest stages of prostate cancer, there are no symptoms. That's true of a lot of cancers. And so that's why we say, even if you feel fine, come get your prostate checked. Okay. And that's very important. Okay. But for men who are out there walking around wondering, and let's say maybe they have, and they can start to notice some difficulties with urination. Their stream takes forever to get it started up, and then when it starts up, kind of dribbles out, and then it starts and stops and starts and stops. And other times when a fella's sitting and he can't hold it very long, when he gets a sensation he has to urinate, he has to drop what he's doing and race to the bathroom.
Like that commercial, gotta go, gotta go, gotta go.
Well, you know, those...
You remember that commercial?
Oh, absolutely. I know that commercial. That commercial is actually for a different type of bladder condition.
Okay.
But the symptoms can be very similar.
Okay.
Absolutely. And so those type of symptoms. And then probably a very important symptom that I'm leaving out is nighttime urination. So if fellas are up at night, you know, running to the bathroom 3 or 4 times at night, that's too much. Once is probably acceptable, but 2 or 3 times, that can be a pretty sure sign of some prostate enlargement and troubles, and is a good reason to come to the urologist. And we can help you with those symptoms.
But you know what you just said, Doc, is so important when you gave out the very first symptom, and you said, and oftentimes there are no symptoms. And I think that's a very powerful statement. Men need to listen very closely to that statement, because they need to know that just because they're not experiencing any symptoms does not mean that a problem don't exist. Am I correct in saying that?
That is absolutely correct. And, you know, it's...
Now, I don't mean to sound like a doctor, you know, but I know a little something, man, you know.
Oh, I know you know, Melody.
But you're correct, Doc. I mean, and we try to use the show to inform. We try to use the show to educate, which helps to empower the community about prostate awareness, prostate health, and prostate cancer, because we have changed the conversation of this disease by engaging in conversation. Everything in life starts with a conversation, and we're hoping that men in the community will listen to our conversation today, and then they will make an informed decision about their health, and they will call. What's that number they should be calling? Can you give us that number again? Give me your office number, man.
My office on Jefferson is area code 314-771-5822, and my number on Hampton is 314-646-0478.
Okay, and let's real quickly. You know, the clock is ticking on the wall. An hour goes fast. Treatment options. We talked about prostate cancer. We talked about the symptoms. We talked about the risk factor. Let's look at some options, some treatment options. If a man is diagnosed with prostate cancer, one of the questions that would be asked, what are my options? Talk about some of those options.
Well, fortunately, most men that we diagnose with prostate cancer these days, because of diligent screening, which the U.S. Preventive Task Force says we shouldn't do, most of these men have a very good prognosis, meaning they have a very good chance of curing this. They have an excellent chance of living many years.
Okay.
Generally, these surgeries are targeted at the prostate specifically. One, of course, is surgery to remove the darn thing, and that's appealing to men, to anyone who wants to have a cancer in their body.
Right.
But radiation therapy has become very effective at targeting that prostate as well, and works very well, and has actually increased in effectiveness tremendously in the last 10 or 15 years, because they can deliver higher doses of radiation to the prostate. A third approach that's gained a lot of attention has actually been what we call watchful waiting, or careful monitoring without an active treatment. Some men are diagnosed at such an early stage that their cancer may or may not progress. Now, it's a diligent follow-up. They come in every 3 months, have their PSA rechecked, have their digital exam performed again, and in the following year might undergo another prostate biopsy. We watch it closely. These guys will choose no treatment, and that's become a more and more popular, because we've been able to pick out these guys who have tiny little cancers that'll never spread.
Okay.
And those are popular forms of treatment these days.
So, are there any other options?
Well, as men get more dangerous cancers or more progressive cancers, oftentimes we will use what's called androgen deprivation therapy, where we take away the men's hormone level, because this fuels the prostate cancer growth. This is reserved for men who have more aggressive prostate cancers, and hopefully a lot of men don't get to that point, although some do.
So you're talking about basically the hormone shot.
That's exactly right.
Okay. Yeah, you're talking about the shot, because for 2 years I was on that particular shot, and I mean, and the side effects, man, wow.
Yeah, the shot is used oftentimes in early prostate cancer for a temporary length of time.
Okay. Some
men 2 years. Some get it shorter than that. There's been some debate about the exact length of time. So there have been a lot of men that are familiar with this shot. What this does is it lowers men's testosterone level because testosterone fuels the growth of prostate cancer. And by lowering the testosterone level, it causes the cancer to shrink into a state of remission. And then we have learned that if we do that, even to men with early prostate cancer, that it helps our treatment, such as the surgery. It causes that cancer to shrink, and so we got a better chance of getting the cancer completely out. Or if we're using radiation, it shrinks the active cancer and allows the radiation to treat it more effectively. And then these guys can stop their shots. Now, some poor fellows later on in life, if they've had recurrence of their prostate cancer, or if they're like the fellows I described who never had it diagnosed at an early stage and it's already spread into the bones, then these guys need to be on this shot for longer term.
Okay. Our guest today is Dr. James Kelly, who is a urologist, and he is one of the many great docs at a great hospital called the St. Alexis Hospital. And he's here on our show today talking about you and your prostate health. Doc, Brother Thee, the cameraman, he asked a question that as a prostate cancer survivor, after prostate cancer, why are we continue using the digital rectal? Why do every time we go into the office, you're still sticking us with that needle? And I'm quite sure a lot of the cancer survivors are asking that question, along with, I'm going to double up on you now, double up with another question. Many survivors that belong to our support group did not know that you can have a reoccurrence of prostate cancer after the prostate is removed. Now, I know I said two things at once, but we got about 5 minutes left, Doc. See what you can do with those questions.
Well, unfortunately, sometimes I can relate a story of a fella who had his prostate treated. He'd had his prostate removed. And in another city, in another place, about 5-6 years ago. And he turned up referred over to me because his PSA level had risen to like 4.5. And I said, gee, he finally got referred. He was getting his PSA level checked, and it was running levels 1, 2, and 3. But unfortunately, what this guy had recurrent prostate cancer, and he really should have been sent over before his PSA level ever got to 1. And then it could have been treated effectively. By the time he got to me, his cancer had recurred and had grown back in the area where his prostate was originally removed, and quite honestly, it was incurable. Even though we've successfully removed a cancer, there are some fellows who have recurrences, and hopefully that percentage is small. And with prostate cancer, if it's probably less than 10%, but it's imperative that you come back for your checkups, because we'd all like to think we're cured of our cancer, and there's a good chance you are cured of your cancer, but you don't want to be foolish going around and have it creep up on you, because if there is a recurrence, you can still be salvaged from that.
It's really surprising to me that so many cancer survivors don't understand that there can be a reoccurrence of cancer in the prostate or of the prostate, however I should term it. They really honestly don't know. They are shocked. You should see some of their faces in our support group meetings when a statement like that is made, and how many hands actually go up in the air of men saying, "You mean to tell me that I can get prostate cancer again, even though the prostate itself has been removed?" They really don't know, Doc. I mean, we got about 3 minutes. Kind of enlighten us on that real quickly again.
Well, I would hope that some of those men, I would hope and think that perhaps some of those men are still early in their fight against cancer. They've been through an emotional roller coaster. They've focused on the problem at hand and the decision making involved in choice of a treatment and education on some side effects. And perhaps it's just eluded them a little bit with all the emotional pressure that, and this is why, though, that they need to continue to come back and get follow-up, because you're always still learning about new things all along the way, and sometimes when you're overwhelmed with a new diagnosis of cancer, you just got to focus on one day at a time.
Give out that number again, Doc. Give us that address, man.
My phone, my office is at 3535 South Jefferson, phone number 314-771-5822, and my Hampton office at 5213 Hampton Avenue, 314-646-0478.
Give us that date out on that great health fair again. Just for the health of... Man, I love that title. Just for the health of youth. What's that date?
The date is Friday, September 7th. That's just 2 weeks from today.
Wow, just 2 weeks away.
From 10 a.m. to 1 p.m. I'll be there. I'll be there at the prostate cancer booth. My name is Dr. James Kelly. And we are, I should point out, that's on the second floor of that medical office building. I'm sure we'll have signs up in the lobby when you arrive.
Okay. The clock on the wall said us all the end of another great show surrounding a very hot topic, prostate health, and also that U.S. task force ruling. Thanks to our guest today on the show. We got to get you back out. Maybe on the next show we got to talk. We got to get you back out. We didn't scratch the surface, man. We still dealing with the basics surrounding this disease. St. Louis, don't forget about the health fair. Thanks again to our cameraman, Brother Thee. He's always here on the spot. Thank you again to St. Alexis Hospital for sponsoring our show today, September 22nd, Blue Light Gala. I'm your host today. I am Brother Melvin Shaheed, prostate cancer survivor, prostate cancer advocate, and a very, very, very proud servant to cancer victims throughout the city of St. Louis. Good evening.
Prostate cancer.